right, welcome everybody. Good morning or afternoon or evening. I know we have an audience from around the world joining us today. I am Rachel Paul with IAAP, and I'm also joined today with my team members, Sam Evans and Debbie Buali. And you are here this morning for the second webinar in our Accessible Remote Working Environment series. Just a few items to go over today. All your lines are muted to prevent any background noise or distractions for our presenter. If you have a technical issue, you may leave a question in the chat and we will try to get to you as soon as we can, or you have the option, there's a raise your hand icon, and we will try to address you individually and get through those. Closed captioning is available. You can select the closed captioning icon on your screen to have the captionings running. And there's also a third-party link that was posted in the chat, and as soon as I'm done here, I will repost that so nobody has to go back up and dig through the chat. This webinar today is recorded, and we will make the recording available on the IAAP YouTube channel. And I try to get that up within 48 hours to have that available to you. We will be allowing time at the end for questions and answers, but throughout the webinar today, you are welcome to post questions in the chat and in the Q&A box, and we will go through those questions at the end. There's a little bit of information on your screen now if you're not as familiar with IAAP. We're the International Association of Accessibility Professionals. And just a quick note there, if you visit our website, you can find out more about certification, educational webinars like the ones we're doing today. We also have a monthly series, so we do on a variety of accessibility topics. And it's a great opportunity as a member to be able to network with accessibility professionals around the world. And you can follow us on a variety of social media to get the latest updates. And we also have a newsletter that you can sign up for, and we'd love to have you. So I am very happy today to introduce to you Lisa Mathess from Job Accommodation Network to be talking today about physical environments and ergonomics. And I'm going to go ahead and turn it over to Lisa. Thank you.
Okay, thank you. So as Rachel said, my name is Lisa Mathess, and I'm a lead consultant here at the Job Accommodation Network. I just need to have a guilty conscience. I'm going to look at chat one more time to make sure this is working. Okay, I can't go back to chat. It is working.
You are, yes, your screen is sharing your presentation. Thank you, Lisa.
Thank you. Sorry. Okay. So yes, bear with me as I go on this telework journey because this is new for me. Okay. So today, yes, ergonomics for working remotely. Okay, so looking at what y'all can expect from today's presentation, first I'm going to take a short moment just to explain the Job Accommodation Network, also known as JAN by many, just in case there are some new faces here that don't know what we do at JAN. Then we're going to take a look at ergonomic basics. What does the term ergonomics truly mean? How does ergonomics play a role in the employee's health and well-being? Then we'll break down what an ergonomic evaluation looks like. Oftentimes there are professionals that perform these assessments, but the information is laid out in that a lay person can do a self-assessment and adjust as needed. Then we will turn to common problems and solutions for those issues, maybe remedies or products that can solve those problems. And then finally, we will get into tips and resources for at-home setups. Right now, where many of us are forced to telework, organizations are putting out some helpful tips which are practical and useful. So what do we do at JAN? Consultants at JAN specialize in answering questions about federal laws that apply to disability rights. Our primary focus is Title I of the Americans with Disabilities Act, along with ADA Amendments Act, but we'll also talk to people about the Rehabilitation Act that applies to federal workers. At Jan, we help our customers resolve job accommodation issues and come up with and implement successful accommodations. We do this by providing consultation on all aspects of workplace accommodations for people with disabilities. Our consultants at Jan will try and work with our clients to identify possible solutions that could enable a person with a disability or a limitation to effectively perform their job. We can talk employment issues regarding a wide range of medical conditions in any career and try to provide ideas that can be tailored to the specific need or limitation. When you call us, we don't really care about a true diagnosis and if it's truly covered by the ADA. We just want to know the limitations and what the problem is so we can advise on accommodations. We've aided Fortune 500 companies with ADA compliance issues down to mom and pop shops looking for a product modification. So it's safe to say we help all customers in all industries and job categories. The best part of Jan has to be that we are a free service. We provide our information and consulting services free of charge. We're funded by the Department of Labor's Office of Disability Employment Policy, which enables us to do this at no cost to our customers. We are a confidential service, so what we discuss regarding the work environment or disability truly does stay between us. The program assistants that answer your call will ask for your name and disability, but that information is truly confidential as it stays in-house. And the only reason we ask for that information is so we can track case notes. If you happen to call back for a follow-up, we can pick up right where we left off. Jan's a national service, and although we are based in West Virginia, we take calls from all over the country and US territories. And we're easy to use because whenever you call us, you get a real person on our end. We're also easy to use because whichever way you prefer to contact us, we probably use it. We're very accessible. All services are done electronically: phone, email, chat, website, and social media platforms. We talk to everyone on the spectrum, from employers to the employee, service providers to friends and family members, but the biggest portion of our calls do come from employers and individuals with disabilities. We can be pretty busy here at Jan. Just last year, we had over 50,000 contacts between people calling us and emailing us and submitting questions using our Jan On Demand feature, or live chatting with our consultants, or of course on our social media. Over 18 million people visited our website last year on askjan.org. So for being a small office in West Virginia, we really do take a lot of inquiries. We have a quarterly newsletter so people can keep up with the different accommodation topics or new changes in the ADA. And we do offer our services in Spanish, where we have a Spanish consultant if you want to give us a call, or you can view our website in Spanish. So getting into what is ergonomics. According to the Human Factors and Ergonomics Society, Human Factors is concerned with the application of what we know about people, their abilities, characteristics, and their limitations to the design of equipment they use, the environments in which they function, and the jobs performed. While the definition that Merriam-Webster gives is an applied science concerned with designing and arranging things that people use so that people and things interact most efficiently and safely. So those are both pretty extensive definitions, but what it all boils down to is that ergonomics is the science of fitting jobs to people. Here are some statistics to show the prevalence of workplace injuries and just how big the impact of sitting has on our bodies. Musculoskeletal disorders, or MSDs, are those injuries or disorders of the muscles, the nerves, tendons, joints, ligaments, and those bones. Musculoskeletal disorders account for 33% of all workplace injury and illness cases. And just last year, a study came out that claims 1 in 2 adults are living with a musculoskeletal disorder. And a 2015 study showed that prolonged sitting increases risk for various serious health conditions such as cancer, diabetes, heart disease, even for those who are exercising regularly. And I have this slide in here really just to showcase that the way we work can be a problem for those with and those without disabilities. It's not unique to any industry in particular or the jobs that we do, but literally sitting itself has been shown to be problematic. The Occupational Safety and Health Administration, or OSHA, has indicated that even when workstations are set up correctly and ergonomic principles are implemented, users could still be at risk for developing musculoskeletal disorders. In addition to information about computer workstations, workstation environments, and ergonomic checklists, OSHA refers to a list of signs or symptoms to look for that could indicate that an employee is at risk for a musculoskeletal disorder associated with computer use. I have them listed here on the slide, but they include numbness or burning sensation in the hands, reduced grip strength, swelling or stiffness in the joint, pain in the wrists, reduced range of motion in shoulder, neck, and back, dry, itchy, sore eyes, double vision, aching and tingling, and then cramping and weakness. If an employee is experiencing these signs or symptoms, it doesn't automatically mean that they'll develop a musculoskeletal disorder. However, it may be good indication that the user could benefit from an ergonomic assessment or an evaluation, and that the workstation may need to be modified. There are a number of reasons employers should consider implementing ergonomic principles into their workplace, and for those of us who are teleworking, whether as an ADA accommodation or because of the current public health crisis. Benefits of a universal design or ergonomic considerations include reducing workers' compensation claims, reducing leave time needed for injuries and illnesses, creating a safe and inclusive workspace, and of course, satisfying your employer obligation under the Americans with Disabilities Act. There are a variety of medical conditions an ergonomic assessment could benefit. A variety of cumulative trauma injuries, such as the bursitis, carpal tunnel, tennis elbow, trigger finger, tendonitis, and thoracic outlet syndrome. But these assessments can also be beneficial for back injuries and hernias. In 2016, musculoskeletal disorders involving the back accounted for almost 40% of all work-related musculoskeletal disorders. Okay, so getting into the best practices when assessing an ideal workstation. A focal point in ergonomic assessments is the position of the computer monitor in relation to the user. To reduce eye strain and fatigue, the monitor should be about 18 to 28 inches away from the user. The top of the monitor should be at or slightly below eye level, and that angle should be between 0 and 7 degrees. Proper placement of the monitor limits the need for the user to tilt his head back or to see the screen, or limit the need for the user to lean forward to see what's on the screen. And if the monitor is correctly positioned, if the monitor is correctly positioned and the user has difficulty seeing images on the screen, additional accommodations such as a screen magnification software may need to be considered. And we also want to be mindful of task lighting and those overhead lights that we may be using in our homes. To encourage proper body posture, you want to reduce the need to turn the head from side to side and reduce or limit strain on the head, neck, and shoulders. Input documents should be properly positioned and frequently used items should be within easy reach. The head and neck should be aligned when using the phone and when looking at the monitor with the user's body properly aligned in front of that computer monitor. Continuing with the workstation setup, when arms, elbows, wrists, or hands are not properly supported, this can result in joint or shoulder pain, numbness or tingling in the extremities, and may result in the employee making adjustments that lead to improper posture. In performing an ergonomic assessment, one would want to consider if the employee's shoulders are relaxed, elbows are appropriately angled, meaning they're not bent upward or stretched forward, and if wrists are appropriately angled while keyboarding, mousing, or using equipment or tools, and whether or not the mouse or tool fits the user's hand. Wrists shouldn't be resting while typing. Wrists should be in a neutral position, not flexed up or down. And then you want to consider sharp or hard edges can irritate the nerves and cause discomfort or pain. So it's good to check those areas where elbows or arms are not being properly supported. Arms or hands may become fatigued from overuse, so it may be important to consider how long an employee is performing a repetitive task and when micro breaks should be taken. A very common ergonomic concern is whether or not the employee's back, legs, and feet are properly supported. Being that our chairs where we spend a great deal of time, ergonomic assessments place a lot of focus on evaluating an employee's posture and position when seated. An employee's chair should be supporting the back to provide lumbar support and maintain the natural curvature of the spine. Feet should rest firmly on the floor, and hips and knees should be resting comfortably as well. Seat pans should be comfortable in the correct size so that movement isn't restricted. There should also be room between the top of the legs and the underside of the desk so that the employee is comfortable and the feet are supported. The employee or user should be able to move the chair around freely and shouldn't have to push off the desk or the floor to move around that area. Proper positioning of materials, equipment, tools, and the like may reduce or eliminate the need for an employee to move in an awkward way or repetitively perform the same motion that causes strain on the head, neck, shoulders, or back. In some cases, tools can be provided to help perform a task, and I'll provide some examples of these later on. Ergonomic assessments can help to identify repetitive tasks and tasks that require exertion, which can then be evaluated or modified to ensure that employees perform these tasks in a way that reduces their risk of fatigue or injury. Ergonomic assessment should also consider individual needs, such as the personal use items or the assistive technology that employees may be using. Right now, with the unique situation of many of us working at home, we need to be that much more mindful of the AT people may need to be successful. Assistive technology and other equipment needed as an accommodation to effectively work at home, such as the screen magnification, screen reading software, speech recognition, larger monitor, video phone, sit to stand desk, ergonomic chair, break reminder software, etc. So we'll want to assess those technologies that are unique to an individual and ensure they too are fitted to that person. Environmental concerns, including noise levels, air quality, and temperature variations, can also be addressed in ergonomic assessments. Luckily, when we're assessing these variables for those of us who are teleworking, we're often in control of our own environment in our homes. But as we've learned, it can still get loud between outside noises or those pets and kids who are creating those loud noises in environments, which could be distracting. So if an employee is rotating through different tasks throughout the day, it may be necessary to evaluate each work setup or analyze each job task individually. Now to take a look at assessing a good computer workstation, I wanted to share a diagram of a workstation in the proper ergonomic setup. As the diagram depicts, an ergonomic workstation is one where the user's monitor is just at eye level or slightly below. The monitor is about an arm's length away, and there's minimal bend at the wrists, and the back is straight, elbows are close to the body, and a backrest is supporting that lower back. The chair is adjustable, the user's feet are flat on the ground or resting on a footrest with room between the front of the seat pan and the back of those knees. This is just one of the many diagrams available that offer an easy guide on how employees can have an ergonomically correct workstation, even while working with what we have here in our homes. These types of diagrams can be a helpful tool for employees and can serve as a nice reminder for proper posture when working on a computer. Okay, now to look at some practices that are easy to fall into, but we should try to avoid as they can cause some issues. Master bedroom with a view and neck strain. I know how tempting it can be to just grab the laptop and lay in bed and work, but this can cause that awkward bending of the neck, eye to monitor distance cannot be correct, and typing is very awkward for those wrists and forearms, and it's just bad practice. Same principles, but this time on a couch, especially when we just want to hop on the work computer for one quick email. Those often turn into multiple emails, and before you know it, it's an hour and a half later. The bent elbows underneath our body weight isn't good for those tendons in our arms, and then the twisted spine. It's just not worth the pain it's going to put your body through. This picture hits too close to home right now, a toddler on your lap while you're trying to type one-handed. The awkwardness isn't ideal, not to mention the distractions this causes. But I know with kids it can be hard and not much you can do, but just to try to be mindful and try to adjust as best you can. Again, I think this goes with the kids from the last slide. Getting on the floor so the kids think you're playing with them and trying to multitask with work, holding papers, again, typing one-handed, we can all see how this can't be ergonomically correct. The person's knees are practically to their chest and they're just bent over that little coffee table. Jan offers information on ergonomics in the workplace, including publications and resource guides. On this slide, we have a screenshot of the Jan Accommodation and Compliance series on ergonomics in the workplace, which could be used to supplement the information presented in this training. To find accommodations based on disability, limitation, or work-related functions, you can also go to our A to Z page on the askjan.org website and navigate to various accommodation ideas and strategies. Okay, so let's take a look at some of the solutions for some of the biggest hurdles we may face here at home. Let's start out with probably the biggest problem, which is sitting. I don't think it's an issue unique to those with disabilities even, but employees with disabilities such as back conditions may have difficulty sitting for long periods of time. Making sure that the workstation is set up so that the back is supported, feet are grounded, arms are supported, and posture is maintained can help alleviate pain and discomfort caused by sitting. There's a wide variety of products on the market that may be beneficial for employees with medical conditions that make sitting difficult. The lumbar support cushions, which right now may be those decorative throw pillows from the couch. Appropriate ergonomic chairs. Maybe you happen to snag your chair from the office, but maybe you're making do with the dining room chair. But now we're going to be adding cushions or folded blankets to raise this up to proper level to the worktop. Adjustable height workstations. I know personally I added a little shoebox under my laptop to get it tall enough where I was eye level with that screen. And then footrests. Again, you want to get creative. The boxes, reams of paper, wood slabs from the garage, all those things can be considered. Next problem, using a notebook computer or laptop. Out of all the new articles I've read this past month, I think the biggest takeaway is you want to connect to a full-size monitor. That way you can adjust the height to the eye level and not bend the neck or start squinting. Same with an external keyboard and mouse. Working on a laptop is, in short, not ideal for a variety of reasons, so connect to a full-size keyboard and mouse. I was lucky enough to grab my ergonomic vertical mouse from the office before we got shut down, and it has made a huge difference. Support for the forearms, supporting the palms is important perhaps with a rolled or a folded up kitchen towel. And if you're having to work some days in the office and some days at home, you may find yourself having to transport that laptop back and forth. So you might want to consider using a wheeled luggage to eliminate that laptop weight you have to lift and carry. So for some products that may help for the notebook computer use, we have docking stations that enable users with a laptop computer to convert it to a desktop computer when at the office or at home. So we can easily plug in the external equipment with the USB ports in that docking station. There are standalone forearm supports you can order for pretty cheap on Amazon. And then of course, we're gonna have to get creative here. So you can see on the bottom right image, a do-it-yourself setup with a woman sitting at a small desk with a laptop strapped to an angled cardboard box. Anything to try and get closer to that ergonomic correct setup. Keyboarding and mousing can be difficult for individuals with cumulative trauma disorders. In this day and age, most employees who work in office settings spend a large portion of their day typing on a computer. Implementing ergonomic principles and making minor workstation adjustments could be a good first step to consider when employees report difficulty typing and mousing. Altering or adjusting the placement of the keyboard or mouse is one remedy. Keyboards and mice come in all different shapes and sizes, and in some cases, the keyboard or mouse might just be too big or too small. Another simple remedy could be to adjust the armrest on the chair. Remember, elbows should be close to the body, and the armrest is there to support those arms in the proper position. Other ergonomic products could include alternative keyboards and mice, an articulating keyboard tray that could be adjusted to fit the user's needs, wrist rests, which a DIY option, like I mentioned, may be a rolled up tea cloth or hand towel to elevate those palms into that neutral position. And again, thinking about those forearm rests to minimize strain or discomfort caused by supporting the arms while typing throughout a shift or workday. The amount of time that employees working in offices spend on the phone may differ, but most employees in office settings do use a phone as part of their job. It can be easy to get into the habit of resting the phone on your shoulder or tilting your head while talking and typing, but by doing this, you may be causing unnecessary strain on your neck, shoulders, or back. Maintaining ergonomic posture while speaking on the phone can reduce discomfort and alleviate pain associated with various disabilities. This can be as easy as relaxing the shoulders, keeping the head upright. It's also important to place the phone within easy reach so you're not having to repeatedly stretch to answer or make calls. Also, taking micro breaks and standing while talking on the phone can be beneficial to maintain postures. Products such as hands-free headset or goosenecked phone holder could be used so there isn't a need to reach for a phone or support the receiver while speaking. Putting phone calls on speakerphone when appropriate might be another solution to reduce pain or discomfort experienced when holding a phone receiver. Another issue we may face is having to read documents. When considering document holders, there's a couple different considerations. You could use an inline document holder that sits between the keyboard or the tray and the screen you're using and is aligned with your body midline, so all you have to do is lower your eyes to look down to see the documents and raise your eyes to see the screen. Otherwise, you could do a screen-mounted document holder and position this to the same side of the screen as your dominant eye. There's also a freestanding document holder, and you want to position this next to the side of the screen and slightly angle it so that it follows a natural curve from the side of the screen. And you don't have to go buy a document holder off the shelf. Many of us have those cookbook holders on display in the kitchen, so you could steal that for the time being. And let's not forget that we don't have to be tied to the chair to do some of the reading. Let us get up, stretch, and move to the couch while we review some of these documents. Little things like that could make a big difference. Eye strain can result from looking at a computer monitor for prolonged periods of time. For some individuals, eye strain could also contribute to the onset of migraine headaches. When employees report that looking at a computer is difficult, a simple remedy or fix could be to reposition the monitor if it's too close or too far from the user. Clean the monitor if dust or dirt are preventing the user from clearly seeing information, or reducing glare by adjusting lighting. Products such as a monitor riser or arm. A DIY option here is going to be to stack up books or a box to get that monitor up higher. Adjust your lighting. Take a look at where your light source is coming from, whether it's the windows, your main ceiling light, or lamps, and adjust the lights and window shades as needed. And you're going to want to continue to adjust the light as the natural sunshine rotates throughout the day. And an anti-glare filter might also be necessary to provide so that a user does not have to strain to see the computer screen. Fatigue can be a result of performing the same task repeatedly over the course of a shift or by not taking micro breaks to adjust seating position, to alternate between sitting and standing, or to stretch. Preventing fatigue by remembering to take time throughout the day for these easy remedies can help to prevent computer-related injuries or an exacerbation of an existing condition. Equipment, including an adjustable height workstation, which may look like working on a stack of something at the kitchen counter to stand and then rotating between that setup and the sit-down workstation you've created at the dining room table, kind of rotating between those two workstations throughout the day. There's also the treadmill or bike workstations could be used to combat fatigue. Amazon and Walmart have pedal exercisers you could ship to your house to keep the blood flowing. And employees may also find it useful to set alarms or reoccurring daily reminders to stretch periodically throughout the day. Okay, I wanted to switch gears to look at some telework considerations, more of an administrative modifications rather than product-based solutions. Of course, job restructuring, removing those secondary duties as an accommodation or changing the way we're performing those essential primary fundamental duties. This may look like a modified schedule. So the employee is working on the hardest tasks when they have the most mental energy or ability to perform. Let's also consider some flexibility here. We know that kids are now home with us while we're trying to work, so perhaps extending those core hours into the evening so work can be done once the kids are pretty much out of your hair. I mentioned the distractions kids and other things can cause, so we might also want to consider noise canceling headsets or looking into apps for concentration issues. Turning the usual phone call into an instant message or an email so there's less background noise to fight with. And also being mindful with your own schedule and really mapping out your day with time chunks and what you want to accomplish during those times. And then of course, don't forget to take a break. I'll get into this more later, but breaks are good for the physical and mental fatigue. In similar premise as job restructuring, workplace flexibility. I mentioned allowing people to do work when they're most energized or around their other duties. It is just the norm now that many of us are trying to maintain a full-time job while having to now watch our kids as well since schools are now closed. So perhaps alternating an employee's schedule, letting them adjust as needed to not only get the job done, but allowing them to help their kids with their own school demands as well. Continuing with the flexibility, you want to allow people to move around, take those stretch breaks, use the restroom, check in with our colleagues, and then of course, permitting use of time for the check-ins with service providers. That may look like a therapist or a counselor for someone, or it may be someone's immunologist for a chronic health condition. So with the flexibility, you may need to consider allowing any missed time to either be made up or allow someone to use accrued leave or unpaid leave when job duties cannot be performed. I highlighted the Jan Ergonomics publication earlier with the screenshot, but let's not forget that we have these ergonomic considerations in this pub and to really go through it and self-assess what you're working with or how you're working. Lots of companies and organizations are pushing out tips and resources to help us better use what we have with our space and equipment. So these links are from Mayo Clinic, Yale, Inc., and System Concepts. And then Pete also has created the Telework and Accessibility Resource Guide to help employers and other ensure that virtual meetings and other digital communication platforms are as accessible as possible. At Jan, in recent times, we're getting lots of accommodation questions on equipment when it comes to basically forced telework due to state orders. So is the employer responsible to deliver and set up those at-home workstations? This isn't clearly addressed by the EEOC, but here at Jan, we would say that better business practice is going to be if it's safe for an employer representative to set up the equipment to make sure that an employee is set up for success. I think that's probably the better approach. I provided the link to the federal resource telework.gov as this is the main hub for teleworking information specific to federal workers, but they also have these two tools that I thought are useful, the self-assessment and the safety checklist. The self-assessment, a good telework arrangement starts with a good self-assessment. Employees are encouraged to consider the following factors in making an honest determination about their telework capabilities. Record any concerns you may have and how you'll address them in order to telework. So this assessment walks you through general considerations, self-management, technology, communication, and appropriate space. And then the safety checklist is designed to assess the overall safety of an alternative workstation, which I think was good. This e-tool from OSHA illustrates simple, inexpensive principles that will help you create a safe and comfortable computer workstation. While there's no single correct posture or arrangement of components that will fit everyone, however, there are basic design goals, some of which was shown on slide 12, to consider when setting up a computer workstation or performing computer-related tasks. The Department of Defense and Computer Electronics Accommodation Program offers this guide, which provides illustrations of proper workstation ergonomics and a checklist for implementation of these strategies, as well as tips for prevention of repetitive stress injuries. As we have gone over, ensuring proper ergonomics in the workplace is a smart business decision because it increases employee productivity and satisfaction. Colorado State University pushed out some ideal tips. We've really gone over many of these, but you want to use a good chair if possible. If you don't have a good chair, add pillows for back and leg support. You want to raise your chair, as most kitchen tables and desks are naturally too high, so you might want to use a pillow as a seat cushion if needed. I mentioned supporting your feet. This could be on a phone book, a step stool, if they don't firmly touch the ground while sitting. Raise that monitor, perhaps using books, old shoe boxes, bulk food you may have bought, and then using external equipment. It's essential that the monitor is separated from the keyboard and mouse. The top of that monitor should be at or slightly below eye level, and shoulders relaxed with elbows being around 90 degrees. Human tech, here's a few good ways to improve office ergonomics at home. I really liked that they had templates hyperlinked for DIY laptop stands. And also in the link on the slide, they have even more resources. They have a webinar, 4 ways to improve your home office, tips for taking work home, and another link of 4 tips for the perfect laptop setup. So you guys can download the slides and get these hyperlinks and kind of look at these different organizations. I think they're really being helpful. National Institutes of Health offers a tool with various pictures and explanations of various exercises we should all be doing. Each category listed on the slide has between 2 and 8 different movements or stretches to do, so it's very comprehensive. So with all the equipment adjustments and being mindful of positioning and postures, we wanted to emphasize that really getting up and moving is the ticket. You want to avoid sitting for long periods of time. And you can still work while moving, so take the phone calls while you're standing. Set reminders on your computer or phone to remind you to stand up and move. And you want to practice the 20-20-20 rule. For every 20 minutes, you want to take 20 seconds and look at something 20 feet away. Also, I wanted to encourage everybody to visit the JAN Corona Disease 2019 page to learn more about strategies for making employment-related decisions concerning people with disabilities. From there, you will see new articles on engaging in the interactive process, managing requests from people with disabilities in response to COVID-19, and then of course a blog on mental health considerations in light of everything COVID. EEOC has pushed out new information, either updating their pandemic publication, or they also had a webinar that you can view in its entirety on YouTube. And then lastly, employers and employers should know that new legislation with the Families First Coronavirus Response Act, which has some leave entitlements if you meet a few thresholds that they've laid out. So for additional information on that, people could contact the Department of Labor's Wage and Hour Division. And now we'll open it up to some questions and answers. Thank you.
Okay, thank you, Lisa. That was great information. We did have a few questions come in, and some of them may have been answered throughout, but just let me go back and look. Um, there was a question about, will you cover how to conduct an ergonomic evaluation remotely or virtually during this time of social distancing?
Really, I think it's more of a, I, you could probably do it over video chat. I know there's some organizations that do complete virtual ergonomic assessments, and I can email out like a list of providers. But I think my tips and tricks are more of like a self-assessment, just being mindful with your own setup.
Okay. And another question was asked, and I did answer partly that you do have resources, all these resources on your website, but someone asked, do you only service within the United States?
We'll provide like accommodation information to anybody, but as far as the ADA aspect and legislation, that's only going to apply to the United States. But if you have an accommodation question, we'll definitely talk to you. But we just don't know the legal requirements of an employer because those are going to be different laws.
There was a question that came earlier about pictures for alignment, but I did see you had several in your presentation after that. Is there a resource that would have some of those pictures that were
Yeah,
included in?
yeah. On slide 15, I stole that one from ergonomics-info.com, and they had a few diagrams. And then also the Department of Defense workbook had a lot of diagrams, and that's linked on slide 37.
Okay, thank you. Um, let's see, we still have, oh, we have lots of time. We still have some questions here. Now, a
Yeah.
question came in, and I wasn't sure if the person was asking for today's webinar or in general about Jan providing interpreters for Spanish-speaking callers.
Okay, and Jan doesn't physically provide the accommodation. We will just refer you. We have vendor lists of where to find those types of accommodations. I feel like we could probably get you in touch with an interpreter that provides Spanish.
Okay,
So
that,
feel free. I left the email on the slide, Jan at askjan.org. You can still call the 800 number and someone could get back to you. We've just kind of changed the way we're operating just due to COVID. So, but definitely email in and we'll get you in touch with the sensory team that can provide nitty-gritty information on interpreters.
all right, thank you. Let's see, we talked about different desks and things that you can use. So somebody had a question about using a large ball to sit on. Has there been any research on that or any recommendations?
Yeah, we see that a lot. I talk to employers more often than people with disabilities. And so employers are, of course, always worried about liability issues, which Jan can't weigh in on because that's legal advice. But yeah, I've seen good things about it, but I also see the problem from an employer standpoint. But they have these new kind of cages for those types of balls now where it eliminates where it doesn't have to roll away anymore. So now the ball is in the cage, so the user is getting the benefits from sitting on the ball, but it's not, problematic for a workstation. So yeah, those are new trendy thing. I'm not sure the science behind it, whether it, is helping or hindering us, but a lot of people are doing it along with the treadmill workstations and of course the sit stand workstations. Everybody at Jan has a sit stand workstation. Um, so we try to do better.
Okay, great. Moving along, it says, it's noted that feet should be placed flat. What about the ergonomic chairs that have the slight kneel to align the back?
Right, right. Yeah, I think it's going to be unique to the person of what they're comfortable with. I know things are marketed as ergonomic, but that could be ergonomic for one person and completely problematic for another. So you really just have to fine tune it to what you personally need.
Okay. Still have some questions coming in here. Oh, this is an interesting one. What color temperature should my lights be? I have lamps with light bulbs that can change colors and also the white temperature as well. I've heard warmer temperatures are better for less eye strain.
Oh, I'm not sure about that. I could definitely look into it. Is there, Rachel, is there going to be a way I could email the attendees
Sure.
information after? Is that possible?
Sure. What we were hoping to do is to be set up a Q&A page
Okay.
after this and the questions that were asked today and post the answers. So we can
Okay, yeah.
certainly.
I would feel better if I could talk to the people on the sensory team and see if they've gotten calls about that, because that's new to me.
Okay. All right. So you mentioned apps for concentration issues. Could you provide more details? Or is there a resource for
If
that?
you go to askjan.org and go by limitation on our A to Z page and go to concentration, everything is linked there, and we're continuously updating those vendor lists. Like once we find out a product exists, we really try to get it on the website. And while we don't endorse or recommend any one product over another, we just try to have, here's all the information, you make a determination what would be effective for you. But yes, short answer is on the concentration page, apps are listed there.
Okay, great. So now the next question involves about slides from the presentation. So just so everybody know, there is a copy of the presentation available on our website on the page for this series, but we will also send out a follow-up email with letting everybody know where the link is for the recording on YouTube, as well as a copy of the slides. And let's see, I think I have one or two more questions here. Working primarily with people with visual impairments, do you have a recommendation for compounding considerations?
That would be a better question for the sensory team. And I apologize, I feel like I'm just passing the buck here, but I serve on the motor team. So I just don't deal with vision and hearing calls day in and day out. But I'll get you information and put it on that Q&A page.
Okay, perfect. Well, let's see, there we go. That was the Q&A. I'm going to move back over to the chat. We had a question came in that says, I work at a Big Ten university and we are currently working remotely. Some of our employees are asking to be reimbursed for purchasing the same items for their home that they have at work. For example, if they have an ADA accommodation for a specific chair or sit or stand station, they want one at their home. We have given them the opportunity to take those items to their home, but they want them in both places. Are we responsible for providing those items at work and for home? I know that's a little bit more of a...
Yeah, well, okay, it's definitely, equipment is not clear cut for teleworking individuals in a normal basis. This was pre-pandemic, it was not clear cut. Because I always tell employers, if people are teleworking as an accommodation, now that's going to be different than teleworking as a benefit of employment. So if it's as an accommodation because they can't come to the work site and utilize what's already provided, then yeah, it makes sense that an employer would just provide the at-home equipment because they're spending the same dollar amount because you're just transferring the equipment from the office to the home station if telework was an accommodation. Now, if telework is a benefit of employment and someone just wants to telework willy-nilly, then I think that's less of an obligation for an employer because they could come into the workplace and use an ergonomic equipment. Now, with the pandemic situation where we're all forced telework, EEOC has said that you still need to engage in the interactive process. And so that should be a request from an individual of, hey, I need this at home as an accommodation. I had this at the office, but now I'm home. And those requests should be considered absent hardship. So whether that looks like someone going to the office and picking up ergonomic equipment and bringing it home, or ordering new, that should be a dialogue between the employer and employee, and it should be approved before someone goes and spends money and then asks for reimbursement, because accommodations aren't retroactive. It's more of a approval or denial than moving forward.
Okay, thank you, Lisa. I'm just going to check. There were a few questions that popped up in both in the chat and the Q&A. It seems like several of you are asking about continuing education credits or certification for attending today. Some of you that I responded to individually, if you can email either info@accessibilityassociation.org or myself as rpaul, P-A-U-L, at accessibilityassociation.org, and I will work with you to see what you need, a copy of an email or registration form. We will certainly work with you to get you a proper documentation of your attendance today. Let's see if anything else. Okay, came in. I think I saw something in the chat here. Let's see. Now, someone just made, I think it's more of a comment, a follow-up comment, and back to the lighting question.
Oh, okay.
And I'll go ahead and read it out loud, so if anybody was interested in hearing that or missed it in the chat. It said, regarding lighting when working on computers, I work with low vision specialists, and blue blocker technology is a big talking point for reducing eye strain and computer vision syndrome. Appropriate lighting depends on an individual's eye condition and can change through the day for various reasons. The National Eye Institute and PreventBlindness.org are great resources. So thank you, Jenny, for that additional information. And at the moment, that seems to be, let's see. The end of the questions here. So we do have a few minutes left. So I saw some people are still chatting in the chat. Sam mentioned that some of our higher ed community members are working with their ADA teams and their university policy about COVID-19 to determine what the university is supporting for this unique instance. So going back to Jill's question about providing equipment at home and at work.
Yeah, this is Lisa again. And yeah, ever since this whole thing started, that's where all my consultations gone to, is what equipment and accommodations in response to COVID, whether it's someone with a suppressed immune system that's now nervous to go back to work, or the telework equipment. So if you have a specific question, do not hesitate to email us, or you can chat on our live chat feature on askjan.org, or email us at jan@askjan.org to talk specifics. And I can definitely link you some resources, because EEOC has made some statements, and I have some excerpts from their webinar that I mentioned was on YouTube, where they've kind of addressed in response. But the biggest takeaway is to be flexible and kind of understanding, and get people what they need to be effective workers and successful for this temporary, hopefully temporary moment in time before we can all get back to normal.
There was a question that came in about any suggestions or ideas for people with limited hand function.
I think the first go-to is always considerations for speech recognition software. Dragon Naturally Speaking is probably the most popular platform for that. And Nuance, the manufacturer of that, is really good about working with companies if there's compatibility issues. They've kind of will work with your IT team to kind of bridge any potential gaps. So I think speech recognition software is my first go-to before considering the on-screen keyboards. Yeah, I like speech recognition first.
Okay. at the moment, that seems to be the end of our questions. Like, so we will go ahead and try to put these questions in a Q&A and make those available afterwards, as well as the recording and a copy of the presentation that was full of great resources and links for everybody to access. I want to thank Lisa for joining us today and providing this valuable information. And thank you to AI Media for providing our captions. I will stick around for a few more minutes if anybody has any last minute questions. I will also post my email again. I see a few others asking about contacting about continuing education credits. So I will post that in the chat one more time. And again, thank you everybody for joining us and enjoy the rest of your day.
Thank you.
Lisa, this is Rachel. If you happen to still be on, there was one last question came into the Q&A regarding accommodations that could be made for individuals who are deafblind during COVID-19 when haptic interpreter interaction may be unsafe.
Oh, that is a good question. Uh, I, again, would feel better if I could talk to the lead on the sensory team and see what she's kind of telling people, because yeah, that's a unique situation. I just don't know the answer.
Okay, we will, like I said, we'll get all these questions listed out and I'll pull what I can from the recording to answer those, and any of these outstanding ones I'll pass back to you to
Okay,
and
yes,
maybe
please
add
do.
to them.
Yep, sounds good. Thank you.
All right, I think, well, that's, yeah, we seem to be good. So thank you again, Lisa, and we'll go ahead and conclude today's webinar.
All right, thanks, guys. Bye.
Thank you.